My name is Melissa Goble, and I'm a women's health nurse practitioner. I have been at Kiner Regional Medical Center for 13 years. I first started out as a OB nurse, labor and delivery nurse. I did that for about 12 and a half years, and then I transitioned to a women's health nurse practitioner in the clinic side of CRMC. My role as a women's health nurse practitioner is helping out the physicians seeing patients in the clinic, assisting with them for procedures if needed, and then going on and being with them, assessing patients and seeing patients as well, rounding in the hospital, discharging patients, admitting patients. During menopause, there's a lot of things hormonally that go on. One of them is which causes weight gain. When we have a lower estrogen level, our bodies then have a tendency to gain weight. So we also lose muscle mass instead of gaining muscle mass like we used to previously. And so the decreased muscle mass, we're not burning as many calories, which causes us to gain weight. Unfortunately for women during their 40s to 50s, that muscle mass decrease has a tendency to cause the gain weight, and the weight gain typically ends up being in our midsection. There are several health risks that are associated with weight gain during menopause. Unfortunately, as we gain weight, our self-esteem goes down. Women aren't as comfortable with it, especially when it's in their midsection and they never used to have issues. So during other health issues would be cardiovascular-wise, high cholesterol, your heart risks also goes up. The health risks associated with menopausal weight gain would be cardiovascular-wise. It's a lot more stress on our heart gaining weight, and women gain the weight in the midsection, which also helps them, or which also puts them at a higher risk for heart disease. High cholesterol is another issue that can be associated with weight gain, and also just our self-esteem. As women gain weight, we tend to not feel as good about it. Things that women can do to avoid the menopausal weight gain would be conscious about it. Know that as you age into your 40s and 50s and transition through menopause, your metabolism is going to slow down, which is going to cause you to gain weight. Other things are exercise, and it doesn't mean going to the gym on a daily basis. It means maybe parking your car a little bit further away from your destination and walking, shoveling snow in the wintertime, going for walks in the summertime, or getting into a regular routine exercise. They want you to get about 3 to 4 days a week of moderate intensity exercise is the new recommendation. Eating right is another one. Eating lots of fruits and vegetables and healthy grains. You can cook more at home, which is going to cause you to be more conscious of what you're putting into your food and what you're also putting into your body then. Other things that you can do are, if you drink alcohol or you drink soda pops, you can cut down to maybe 1 a day, because those have a lot of empty calories in them as well. Portion sizes is another big thing when it comes to menopausal weight gain. You can assist yourself by using a smaller plate or a smaller bowl to try and help you not overeat as much. And when you're going out to eat, be conscious of what you are eating and try and eat or pick something higher with a vegetable content or higher protein, the healthy proteins. As we transition through menopause, there are many nutritional needs that also change, not just physically and emotionally, but also the demands that your body needs. One of them being eating iron. When you transition through menopause, you don't have your menses anymore, and so therefore your iron needs go down. Your calcium intake goes up, because as we age, our transition to osteoporosis can occur, and so therefore our calcium needs go up. Vitamin D is another one that, as people, and especially Minnesota here, we kind of have a tendency to lack. So it just means getting some sunshine on your face, your hand, or your arms, or your legs, and just going out like 2 to 3 times a day for 5 to 10 minutes. It does not mean that you need to go to a tanning bed, because that can increase your risk of skin cancer, but it means being exposed to that, because our diet doesn't contain a lot of vitamin D in it. Eat less, move more is a great way to help that menopausal weight gain. To make an appointment, you do not need a referral to come and see our OBGYN group.